Hello, my name is Candace Johnson. I am a second-year student at Florida A&M University, Division of Physical Therapy. This video will describe manual lymph drainage for a patient with upper extremity lymphedema. Hello, Ms. Kimbrough. How are you today?
I'm good. How are you?
Good. My name is Candace Johnson. I will be your student physical therapist today. Today we will run through some techniques. I'm going to do some manual lymph drainage. I understand that you're having symptoms of lymphedema in your right extremity. Is that correct?
Yes.
Okay, or in your right arm, excuse me. So what we will do today, I'm going to perform some lymph training or lymph draining on your arm. What that will include is me doing some massage techniques that will require me to touch you. So are you comfortable with that today?
Yes.
Okay, great. So while I'm doing that, I will have to expose some different areas on your body from head to toe. Is that okay with you as well?
Yes.
Good. What this will actually do, this technique is going to help decrease your symptoms with your lymphedema that you're experiencing. It's going to help to decrease your edema, and then it will also help promote drainage from the unhealthy lymph nodes that you have to your healthier lymph nodes so that you can, once again, decrease your symptoms. Okay, so what I will do is wash my hands so that we can begin.
Okay.
Before I start my manual lymph drainage procedure, I do want to make sure that I check the skin integrity of my patient for any scrapes, any cuts, bruising, lesions of that sort that would contraindicate my procedure. So I check the arms, check the hands for any redness, any swelling other than the edema that might be present. Good. Bilateral checking. Again, good. Make sure the blood flow circulation is efficient. Lower extremity check. Feet as well for any circulation. And after that, we will begin. Okay. So first, I will start my manual lymph draining with supraclavicular. At the supraclavicular area, my concentration will be on the working phase and the resting phase of lymph drainage. Working in C motions. Down the area of the supraclavicular. Next, I will do effleurage on the upper thorax. Next, I will perform drainage at the axilla on the unaffected side. Her affected side is on the right upper extremity. So I raise her arm up. And my drainage will go toward the lymph node. Are you comfortable?
Yes.
Is there any pain that you're experiencing at this moment?
No.
The affected side. Once again, using my C motions to work the drainage into those nodes. After that, I will move my drainage from the affected side to the unaffected side. Next, I'm going to drain at the abdominal region, so I will have to expose your stomach. Is that okay?
Yes.
Good. So next I'm going to perform abdominal lymph drainage. I will start my lymph drainage in the center of the abdomen, and I will work all 4 quadrants starting with the left side first. When I do my drainage, I want to be sure to perform my C motions on exhalation of the patient. So the center, going up, the left, going up, back to the center, up, lower left, down, center, other right, up, back to the center, and the lower right, going down. After that, I will perform drainage on the inguinal portion of the patient. So I'm going to cover her back up, and I will have to expose your groin or your inguinal area, okay? So keeping my patient modest, perform my drainage, and this will be bilateral drainage. And I will come to the other side. Once I'm done with the inguinal portion, I will do a rework back at the abdomen. Once again, starting with the center on exhalation. Upper left, up, center, lower left, down, center, upper right, up, center, lower left, lower right, down, center. Working my way back up to the axilla. And I will help promote drainage from the affected side to the unaffected side. Now I will promote drainage from the axillary region to the inguinal. That concludes drainage of the trunk. I will now promote drainage of her upper extremity, of her affected upper extremity, which is on the right-hand side. I will start with the deltoid, working my way up. Then I will work down the arm in that same upward motion, using my C. Once I get to my hand, I will be sure to perform my drainage on the dorsum portion of the hand first. Then I will move to the palmar side. Once I've completed that, I will drain the digits, working distal to proximal on the lateral surfaces, into the web spaces. Then I will rework the upper extremity, palmar surface first. And dorsum. And then work my way back proximal of that upper extremity. Lymph drainage does require an overlap of those C motions to ensure that all portions of the extremities or the areas being exposed are covered. Back up to the deltoid. And I'll do one last promotion from the affected side to the unaffected side. Once that's complete, I will do an effleurage of the upper thorax. And then lastly, drainage at the supraclavicular area. That completes our manual lymph drainage. Next, I will be sure to instruct my patient on any safety precautions that she'll need to focus on and also what to expect in the future. Okay, Ms. Kimbrough, we have completed your manual lymph drainage. Are you feeling okay?
Yes.
Okay, was there any pain that you experienced while I performed it?
No.
Okay, good. So once again, that helped to promote drainage of your upper extremity. Hopefully your symptoms will lessen. Once you go home, I do want you to take note of a few things. I do want you to keep your upper extremities or keep your extremities moisturized. So that includes, whenever you're taking baths, make sure you're using body wash, something that's soothing to your skin. Also moisturizing with lotions. But make sure that you're not using scalding hot water. Lukewarm water is fine, just enough to keep your areas cleansed. Also, I want you to keep in mind to wear sunscreen. Also, some bug repellent spray. We don't want to promote any cuts or scrapes as well, so that could include using maybe an electric razor versus the manual kind. Also, avoid any instances where you could be scraped or anything of that nature, so keep that in mind. Also, what I want you to keep in mind is not to do any extraneous activities because that could exacerbate your symptoms of your edema. I believe that's all that I have. Do you have any questions for me?
No, I don't.
Okay, very good, and I will see you next treatment.
See ya.